Vista is a federally qualified health center. Really, we're providing health care to everybody. And when we say everybody, we mean people who have insurance, people who don't have insurance, people who don't have enough insurance.
We take care of everyone. Like, that's our mission, right? And I tell that to my patients all the time. It's the beautiful thing about a community health center is that everyone is welcome here.
Really, it's about the mission here. We're here to provide exceptional health care. And you can see it not only in our providers who are helping people and are patient-facing, but even through like our finance team or the communications team that I'm part of, or even medical records. We're all here and everybody has a story about why they're here helping people.
So I started at Peak Vista as a patient at the pediatric center. My mom didn't have to worry about me getting sick or not having the right vaccines for the year. And I think that really sparked a kind of like a reminder of why I wanted to work here and why it's so important that I do a good job every time I help someone. Because it's not just that I'm helping clinical staff, I'm helping the clinical staff help people like me.
So I feel really honored to work at Peak Vista. Like, to me, it's the heart of my work and my mission. I believe that everybody should have access to healthcare. It's funny because in preparing for this interview, I was thinking about my first interaction with Peak Vista. And my first interaction was about 23 years ago. And just feeling really well cared for. Nobody was judging me, or I didn't feel like I was getting lesser care because of the situation that we were in financially. I was young, I was nervous, I was broke, I didn't have a place to live. And to greet me with like that warmth and kindness and humor was a game changer for me, right? And for my husband too, to know that we were going to be cared for.
I see myself in a lot of the patients I see because I am also an immigrant. I was also a refugee here, but I was really young when I moved. So I see myself as a person that needs to kind of give back. I feel like I'm in a well-positioned place to give back. I can speak the language, and especially since I work with children, like that's really helpful when they're scared, and for me to make a connection with them. And so I think, like, for example, one of my most favorite connection I've made is like, I'd seen this kid for a couple years. When she first started coming to me, she didn't speak any English. Now she speaks English, which is really cool to see. And she just told me recently, she's about 10, she just recently told me that she wants to be a dentist when she grows up. And I was like, telling her like, hey, I think that's great. You can, I hope you're a dentist, or you can be whatever you want to be. Because, I want her to know that, someone believes in her. We're in a place where they may see us for multiple visits, and if they feel like we truly care about them, we can sometimes be the single or few voices that are telling a patient, I believe in you and I care about you and I'm going to take care of you when you're here.
It always comes back to the mission. If you're in a meeting, it goes back to how can we make this easier for our patients? How can we make this material so that our patients are understanding it, so that they're able to access their healthcare better?
You're helping the community in the sense, it's not just a job, it's a mission.
Because it isn't just the provider and it's not just the assistant, it's the receptionist, it's the data analyst that is giving me the data to help me figure out how to lead my team. Like, we're all working together. So I think like our strength is that we all know what our main goal is, right? And that's to serve our patients.
As a provider, I choose to be here because at the heart and at the mission, and also in my heart, is that I think everybody should have access to care. We're working with people who oftentimes have had really hard lives and hard stories, and they've been hurt by society, by the medical community, and so we have to work a little bit harder. But the work is so rewarding because to have somebody who is vulnerable in the world, to have somebody that maybe society doesn't look upon well or treat well, and to offer them that kindness, that respect, and then to see their heart kind of open and that smile and that trust develop is the greatest gift. It really is.